Hello everyone, this is your nursing student Brian, and for today's video, I'm going to perform or execute the proper way of gloving. Basically, gloving is a placing of gloves on the hands during physical examination and invasive procedures such as surgery and any other nursing procedures like taking vital signs. So this is done to protect the health practitioner and the patient from transmissible diseases. One of its purpose to enable the nurse to handle or touch the sterile objects freely without contaminating them. Okay? Also, to prevent transmission of potentially ineffective organisms from the nurse's hands to the clients at high risk for infection. So equipments needed, we only need sterile gloves. So I have here with me my sterile gloves. And before using the gloves or any types of gloves, you need to consider the size and expiration date of your gloves. So I am using a sterile latex surgical gloves which is powder free. So its size is 7.5 and expiration date is on 2025 on September, okay? First procedure we have in gloving, of course we need to perform hand hygiene or hand washing. We can also use isopropyl alcohol or any type of alcohol as long as it is antiseptic or disinfectant. Alright, so we need to apply an alcohol. This is to prevent the spread of bacteria, viruses, or any microorganisms. Alright. Next procedure, we need to open the package of the sterile gloves. Place the package of the gloves on a clean, dry surface. Any moisture in the surface could contaminate the gloves. So you need to avoid that one. Next is we need to remove the inner package from the outer package. Alright. We need to be careful in removing the inner package as it may result to the contamination of the sterile gloves. Okay? We need to be careful and we need to be mindful enough not to touch the inner package, which is the sterile area. Alright? Alright. A little bit. Alright. Next procedure, we need to open the inner package by following the manufacturer's directions. The inner surfaces which are next to the sterile gloves will remain sterile. So we need to avoid, we need to be careful in touching the sterile area, okay? Alright. We're just only allowed to touch in the edges of the sterile area. And the package rather. Alright. There you have it. We need to be careful. Next procedure, we need to put the first glove on the dominant hand, okay? If the gloves are packaged so that they lie side by side, grasp the glove for the dominant hand by its folded cuff. As you can observe, there is a folded cuff, okay, against the palm. So it is unlikely to contaminate the outside of the gloves. So by the way, the sterile area is the outer side of the gloves, okay? And the inner and the unsterile area is the inner side of the gloves. So we need to avoid touching the outer part of the gloves as it result for contamination, okay? Alright. We need to put the first glove on the dominant hand, which is my right hand, carefully. Alright. There you have it. Alright, ensure that all your fingers are inserted in a correct location. Okay, just leave it like that. Alright. Next procedure, of course, we need to put the second glove on the non-dominant hand, which is my left hand. Okay? We need to be careful, and we're going to use the sterile area or the outer part of our gloves. So we're going to put our two fingers, and we need to distance this thumb. Okay? And the unsterile areas, it may contaminate these gloves. Okay? Alright. This one. Alright. Sterile to sterile is okay, and it is advisable to use. There you have it. We need to be careful not to contaminate the sterile area. Okay. In adjusting the gloves, you can use the sterile area. Okay. Okay. This one. This one. Okay. The other one. All right. All right. So now you can perform any procedure in nursing. I mean, you can now perform in any procedure. Okay. Always put your hands in this position as not to contaminate the sterile area. All right. We can now perform taking body temperature of my client. Okay. So prior to performing the procedure, we need to introduce ourselves and verify the client's identity using agency protocol. Okay. We need to explain to the clients what we are going to do and why it is necessary. Okay. So hi, hello sir. Good afternoon. I am your nursing student, Brian, and I am going to take your body temperature. Okay.
Yes, sir.
Okay. So may I know your name, sir?
My name is J. Lloyd Alpelago, sir.
Okay, your birth date?
April 6, 2001.
Okay, sir. So I am one of its purpose, sir, why I am taking your body temperature is for us, your health practitioner, to monitor if there is any abnormality within your temperature. If there is, we can give you an immediate nursing intervention or nursing care. Is it okay?
Yes, sir.
Okay. So we need to provide for clients privacy. Okay? Alright, we can now perform taking body temperature of our client. First, we need to have our thermometer. We need to disinfect our thermometer. Alright. Can I pull this up, sir? Is it okay?
Yes, sir.
Okay. Can I put this one, sir, in your axilla? Is it okay?
Yes, sir.
Okay. Alright. Okay. After the procedure, you need to remove and dispose of use of glove. You need to dispose your gloves in a yellow trash can for infectious waste product. Okay? There is no technique for removing sterile gloves that is different from removing unsterile gloves. Okay? Alright, we're going to remove these gloves. This one. We're going to use our sterile area, sterile area, in removing the dominant hand gloves. Okay? Then pull it up. Oh my god. It's okay. Then we need to remove the other one. Alright, there you have it. And now you can put this one on the yellow trash can. Alright, we need to perform hand hygiene after the procedure. But for me, I can use isopropyl alcohol, which is antiseptic or disinfectant. Since I'm only done taking the body temperature of my client. Okay? After that, after performing hand hygiene, we need to document that sterile technique was used in the performance of the procedure. This is to maintain professional accountability. Okay? Thank you. Okay, sir, thank you for your participation.
You're welcome.
All right.